All right, welcome everyone. This is Brandy Waliga from Violence Free Colorado. I'm the Technical Assistance and Training Specialist. I'm going to be talking to you about our confidentiality issues webinar, and I'm also here with Liz Stewie, who's the manager for training and technical assistance here at Violence Free Colorado. So she's going to be monitoring our chat box. So as we work through this webinar, feel free to type questions in the chat box, and we'll go ahead and answer those as we move through the webinar. And unless there's something that we're going to cover later on, we'll let you know. We also have time at the end buffered in for some more questions. So we'll go ahead and get started. So this is the Healthy Organizations webinar series. So this is webinar number 2, Navigating Confidentiality Issues Between Roles. Just as a plug, our next webinar in the Healthy Organizations webinar series is going to be on January 16th at noon, and that one is about creating and sustaining volunteer programs. So stay tuned for that one on the 16th, and there's still time to register for that if you aren't registered already. Okay, so let me go ahead and get started here. All right, my computer froze. There we go. Okay. So just a couple things to kind of let you know what we're going to cover today. We're going to talk a little bit about some of the updates for the 2019 Confidentiality Toolkit, go over a few general confidentiality reminders, and then also focus on some best practices in upholding confidentiality and focusing on Section 4, which is a new section of the toolkit regarding the roles and service provision, as well as questions. So are there any questions before we get started? Nope. Okay. All right. So I want to start with giving you all an overview of what's new in our confidentiality toolkit. So the original toolkit had come out 10 or 11 years ago, so it needed some updating. So we actually went through and updated each section, and some of that was simple with just kind of updated language, and some of it was more comprehensive, as you'll see as we move forward. So we also made sure all of the templates and links that are in the toolkit are all updated, and some of those templates and links are connected to DVP as well as NNEDB, so they're great resources. The foundations of confidentiality is actually in each section. So what that is it really kind of goes over the legal and statute foundations about confidentiality for community-based advocates here in Colorado. So we included that in each section because each section can be its kind of own standalone. So you don't have to go searching through the whole toolkit to find those specifics or find that statute. So we included it in each section for that reason. And then also we have some new decision trees, and they're about looking for if confidentiality is applicable and what that looks like in a situation. There's also a decision tree about releases and a decision tree related to mandatory child abuse reporting. We also have Section 9 in the toolkit is actually updated about working with teens and minors in general. So it actually has some clarified language about emancipation, which we often get some questions about that here at Violence Free Colorado for technical assistance. So that's also a great resource to kind of look at if you're having questions about working with minors or what kinds of program guidelines you'd like to put in place. That can be a really helpful section. And then Section 4, as I mentioned, is brand new, so we're going to dive into detail in that in a little bit. And there's also, again, new links to all of those templates and all of the online resources and references that we had for this toolkit. So there's a lot more to it. So as I mentioned, the foundations of confidentiality, I'm not going to go through this whole slide with you. Basically, this is the statutory language that we have here in Colorado for community-based advocates. So one of the things that's really important to remember is that for community-based advocates, you know, they have very specific guidelines, and those exceptions to confidentiality are few and far between, but we're going to go over those. And it's a great reminder that community-based advocates for domestic violence or sexual assault survivors support services, they don't have any mandatory reporting guidelines or mandatory reporting statutes or anything requiring them to report suicidal ideations or homicidal ideations or the abuse of elders or at-risk adults. Those are things that community-based advocates do not have to report. So that's a good thing to keep in mind. And it's also going to come up later when we talk about different exceptions to confidentiality. So this is the section that is in, this language is in each of our sections in the intro. So it's a good reminder that it's there, and we're going to cover a few more pieces of this. So when we look at the confidentiality flowchart here, anybody who is an organizational representative, so that could be staff, it could be board or volunteers, they can't disclose personally identifying information about a survivor or client that they're working with. So the exceptions to that are if you have a release, and we're going to go into some more depth about and more details about releases in a minute, but having a release that is voluntary, informed, time limited, and written, that's all of those are best practices. And then another exception would be a statutory mandate. So again, for community-based advocates, the statutory mandate that we're looking at would be the mandatory reporting of known or suspected child abuse or neglect. The court mandate, that actually would fall under a subpoena or a search warrant. And we know that domestic violence or dual domestic violence sexual assault programs can take some steps to attempt to quash that, depending upon what that subpoena or search warrant is asking for. So it's important just to kind of like have this visual of reminding ourselves that, you know, there's a lot of protections in place for community-based advocates, and there's still some exceptions to confidentiality. One great reminder I think can be helpful is that, you know, when you're talking, it doesn't matter who you're talking to. If you're a community-based advocate, your confidentiality responsibilities, they don't change based on who you're talking to. One of the things that can come up for, I think, a lot of programs is that maybe there's pressure, for example, from someone in law enforcement or someone from another organization who might be aware that you're working with a survivor. Again, your community-based advocate's confidentiality still stands and is still really important to uphold, obviously, because that doesn't change based on who you're talking to. So it's important to remember that. Even when we might get pressured from an outside entity looking for information, even in the best case situations where everybody means well and wants to give resources to a survivor, it's still really important to keep that in mind. So thinking about releases, I think it can be really helpful to kind of just use this as a reminder. So when we think about releases, as I mentioned before, releases are voluntary, so there's no requirement to sign those releases. They're informed, so survivors are aware of what information exactly is going to be shared. The informed component is also important about a survivor understanding what might happen to their information once it's released. And making them written is actually best practice. We know sometimes that there can be an emergency situation where maybe a verbal release is utilized, and we know that that's not best practice. And the goal would be, if some kind of extreme emergency happened in that situation, that you know, a written release be signed immediately, as soon as possible, depending upon that situation. And we also want to make sure they're time limited. You know, sometimes other organizations outside of domestic violence programs might want to sign a blanket release for 6 months or a year. And, you know, when we think about, you know, protecting survivors' confidentiality and protecting, you know, survivors' right to their own information and controlling that, creating a time-limited release is really important because it really offers more empowerment to the survivor to change their mind or to make sure that we're staying on top of what is actually being shared. So the time-limited piece is very important. And, you know, thinking about, you know, other types of releasing information. You know, I mentioned the court mandate earlier, and this is a good reminder that programs, you know, are really encouraged, and they must, you know, try their due diligence to fight that mandate. or to fight that subpoena or whatever that is. So that moving forward with that, whether that's through a supervisor or through an executive director, whatever your chain of command is when looking at that. And when you release information for child abuse reports, for example, it's still really, really important to remember that child abuse reporting is also still has some limitations. Informing survivors about what information you're going to share first is very key, as well as remembering that you're not sharing everything about the survivor. You're only sharing things pertinent to whatever that mandatory report is, even when you might get pressured to share more information or to, tell more about what else do you know about the situation overall, because that's not what the mandatory report requirement is. So it's important to kind of look at, sometimes confidentiality, I think, can be really tricky in ways that we can have a lot of external entities kind of pushing and trying to push that boundary a little bit. But as community-based domestic violence advocates, it's super important to remember that there's a lot in place to help you uphold those boundaries. So a little bit more about releases. We think about best practices. So I already touched on a few of those, but ultimately, we talked about releases being, making sure that they're written and time limited, as well as voluntary and informed, and those are important key components. And the best practice is actually using releases as little as possible. And what that means is really trying to work, advocates working with survivors in a way that the survivor can, if possible, share their own information, if there's any way to be creative about that. And so one way is using three-way calls, really talking with the survivor even beforehand about what they might want to share so they understand what they might be asked from another entity or community resource. But that can be a really helpful way that a survivor can be in charge of sharing their information, and once that three-way call is set up, then the advocate can drop off and doesn't have to be part of that conversation. And that way, then the survivor is talking to a community partner or a potential resource for them, can talk to that person directly and actually know that they're in charge of sharing their information. The other thing too is thinking about when we get a release for information, if the survivor's not able to share that themselves, really looking at also, is this part of a safety plan? Being really, really clear about what exactly is going to be shared. Sometimes it can be so much easier if we have a release that says something like collaboration or for the duration of advocacy or things like that. But those, again, aren't best practices because the goal of having a release in place is going to be for the protection of that survivor's information. So looking at, recognizing if it is an appropriate time for release, really looking at what's the actual purpose of this? How does it play into safety planning if possible, if that's appropriate, or how does this help a survivor accomplish something that they want to accomplish? So, and that's where when we look at releases, that they're survivor-centered and they're not really about domestic violence programs administration and easing of things. They're really about what does that survivor want to do and how do we help them accomplish their goals. So also thinking about the most protective privacy option. So really, again, this kind of echoes what I mentioned before is, are there other ways that the survivor could do things directly or get their needs met in a different way so that they get to be in charge of sharing their information? Maybe that looks like writing a letter that the survivor gets to be in charge of sharing that information with another entity if they need to. So really looking at what's the most protective privacy option for survivors in general. All right. And just a reminder, feel free, if there's questions that pop up, feel free to type in the chat box and we'll also have questions later, time for questions later. So I mentioned before, what are other ways that we can reach the same goals? I think that can be really helpful just to keep it in mind so we don't get on automatic pilot thinking, okay, well, I just have to do, as an advocate, I just have to do this for this person. Because I think we can get in that trap. And again, it doesn't mean that that's not appropriate and adequate in many cases. But when we challenge ourselves to really think about, like, could this look differently? How much, autonomy does this survivor have, and how do they get to share their own, own information and be in charge of that? All right. So I'm going to dive into section 4 of our confidentiality toolkit. So the name of this section is Navigating Roles in Service Provision. So again, really important to kind of think about all these different moving parts. So I think it can be helpful to kind of look at the basics. Let's just kind of start with those. So sometimes we use these terms interchangeably, and I think that that's common, and oftentimes within context, we might know what each other means, but just for some clarity, especially for the purposes of this webinar, but in general, I think it's helpful to understand the differences, for example, between privacy, confidentiality, and privilege. So when we think about privacy, privacy is really someone's personal choice about whether they want to disclose the information. It's just that simple. Every person gets to, decide if they want to share or don't want to share whatever that information is. When we look at confidentiality, confidentiality is really a responsibility to protect someone else's choices about disclosure. So when we think about this for advocates, it's really the promise, a promise to not intentionally disclose information, as well as taking protective measures to challenge any attempts for someone else to take that information, or to take protective measures about anyone else unlawfully disclosing information, and letting survivors know about any attempts for someone to get information about them or take information about them. So confidentiality, again, I think tends to be the phrase that's used most, even when we're talking about maybe privacy or privilege. So it's helpful to kind of understand that confidentiality is really a responsibility to protect someone else's choice about their information. And then when it comes to privilege, privilege is a legal rule. So it's a legal rule that prohibits the disclosure of private information against someone's will. So an advocate, can't be forced to disclose information, and neither can a survivor, actually. So it's important to know that. So a court, for example, can't force a survivor or advocate to disclose information shared between their relationship, or be punished for refusing to share that information. Again, we know that there can be challenges to that, or sometimes maybe, for example, a defense attorney might try to push that and say that they want, certain records and whatnot. But again, there's legal rule in statute in Colorado that helps with upholding privilege that domestic violence advocates have. So it's also another piece about privilege. The privilege is held by the survivor. So even though there's this legal rule about prohibiting the disclosure of information, the privilege is held by the survivor, and the survivor actually gets to decide what information gets shared. Again, it's also up to advocates to make sure that survivors understand what the risks might be of sharing information with certain entities, not to dissuade them, but really to make the greatest, most informed decision about understanding where that information can go. So again, looking at privacy, privilege, and confidentiality, I think it could be really helpful to have some clarity with those definitions as a starting point. And one other part about when we think about confidentiality in general is it really comes down to the clarity of roles within an organization. So this is kind of the core of many, many questions that we get about confidentiality. And so when you have clarity within your organization about the different roles that each person plays, and preferably not having dual roles, because that can be super confusing for both survivors and advocates, but really looking at what is that person's role, and that really dictates what kind of information or what kind of confidentiality guidelines that they're going to follow. So when we think about roles in general, it's also important to be able to explain other people. So for example, a A community-based domestic violence advocate, for example, might be really helpful for that person to be able to not only explain their own role and their own exceptions to confidentiality, which would be mandatory reporting of child abuse and neglect, to make sure that the survivors that they're working with also understand, well, if you're going to be working, for example, with certain systems advocates, that they have a different level or different types of exceptions to confidentiality. It's super important to kind of be able to not only talk about your own role, but be able to explain to survivors what are the different exceptions to confidentiality in other areas or entities that they might encounter. That might sound really simplistic and really basic, but again, I think it goes back to a lot of times, folks that we're working with are going to be pretty overwhelmed, and it can be really confusing to figure out who holds confidentiality and when, and what can I tell this person and what can I tell that person. So I feel like that's one of those pieces that has gentle repetition when working with survivors, making sure that there's an understanding of whatever entity they're working with, that they know where their information might go or when it's protected or not protected. So another component of Section 4 is also discussing kind of in-house or clinical or therapeutic services. So we know that around the state, there are some programs, some domestic violence support programs that do have in-house clinical or therapeutic services. So that means that the folks that there's employees who are licensed or registered unlicensed social workers or professional counselors or marriage and family therapists, and they might be providing mental health or substance abuse treatment, as well as, they're going to have credentialed specific services that are different than the general individual or group domestic violence or domestic violence and sexual assault dual program advocacy services. So when we talk about in-house clinical therapeutic services, what we're really talking about is folks who have their role is to provide mental health or maybe substance use support. So that's their role. And again, like I said, across the state, there are some programs that have those services in-house. So one of the things that's very important about that is that understanding, first and foremost, we actually in Colorado, clinical and therapeutic staff, whether they're in a DV program or not, they actually they have their own statute. They're named in the statute regarding confidentiality and privilege to not have to testify without consent. One of the interesting things to note is that, I think in Colorado, as well as in many other states, there tends to be a practice where mental health records tend to be more frequently subpoenaed and eventually entered into court records, way more than maybe a domestic violence program record would be. It's just an interesting thing that I think sometimes mental health professionals might forget that they can challenge. It doesn't mean that they're going to win that challenge, but we know that it's an important piece about understanding all of the different components to that privilege statute that we have in Colorado. So I just wanted to mention that because I think that it's something that is frequently forgotten and can be really helpful to remember, especially if there's clinical or therapeutic staff embedded within a domestic violence agency. So the thing about clinical and therapeutic employees, so recognizing number one is that they actually have they have different exceptions to confidentiality. So community-based advocates, as we talked about earlier, their exception to confidentiality is primarily, not solely, but primarily looking at the mandatory reporting of known or suspected child abuse and neglect. And clinical and therapeutic staff have that as well, but they also have mandatory reporting of at-risk, abuse of at-risk elders, and that's defined as someone 70 or older, abuse of at-risk adults in general, as well as suicide, homicide, and school threats. So anybody who falls under that category of clinical or therapeutic staff and is employed directly through or with the domestic violence program, their exceptions to confidentiality are very different than a community-based advocate. And that's really at the core of this section 4. It's really looking at what are the differences of exceptions to confidentiality in the different roles. And so with that, a huge piece that is important to remember is we want to protect survivors' confidentiality and protect survivors' information. And so that leads to our best practice, recognizing when there's differences in exceptions to confidentiality, it is considered best practice to maintain separate and protected records access and storage, so that's physical and electronic. And it's considered best practices to obtain releases of information for any information shared between advocacy staff and clinical or therapeutic staff. And again, the goal of this isn't to make things more difficult or make things more cumbersome. The underlying goal is protecting clients' confidentiality and the survivors that we work with, giving them choices about who to share their information with. So when we look at the exceptions to confidentiality, the differences there, we really want to look at how community-based advocates have, far fewer exceptions to their confidentiality than clinical or therapeutic staff would have. So that's where we really want to look at making sure that programs are understanding that the goal would be to keep documents separate. And I know that that can be really hard, especially in smaller programs. And again, one thing to remember is we're talking about best practices, and we're talking about things that are recommended. And we actually talked with the Confidentiality Institute when we were revising the Confidentiality Toolkit, and we got some guidance from them, and that was really helpful to kind of sort some of these issues out. So again, if there's questions about this or you're not sure how your program might separate things out, that's one of the things that we can help with here. So just a side note. And one other piece about clinical and therapeutic services is really looking at some programs will also contract externally. So maybe the domestic violence program is getting some funding that they can contract with a therapist to pay for a certain number of sessions or a certain number of contacts with an external resource, so that basically then an MOU is in place or a contract of some sort. And in those situations, you're still going to need the releases. The records are going to be kept by that mental health professional. They're going to be the ones in charge of creating, and maintaining records. And it would be still imperative that there's a release on both sides. The survivor signing a release with the domestic violence program. If there's any information that needs to be shared, for example, some programs need to know like what dates of service were there in order to have their funding fulfilled as a requirement. Really looking at what's needed, what's the minimal amount needed in order for that kind of relationship of a contract or a referral-based kind of program can exist. So this is kind of the nitty-gritty and kind of the nuts and bolts of really looking at the differences in our confidentiality toolkit. So I'm curious if there's any questions so far about this new section. All right. Well, feel free, chime in if you have any questions at all. This next piece, I think, is also, this was one that we were, took us a bit to kind of make sure we could iron out so that it could be as clear as possible. Supervisors of community-based advocates are covered under the statute that discusses privilege. So they're covered in there. However, we talked about roles earlier, and it's very important to really look at what is someone's role in an organization. So for example, what is a supervisor's role if they happen to have a mental health license? So maybe a supervisor in an organization has an LPC or has an LCSW, for example. Part of that, we want to look at whether or not that supervisor is utilizing their mental health license in that role. And actually, I want to back up and say that's the same for a community-based advocate as well. So a community-based advocate, for example, maybe they have a master's degree, maybe they got a mental health license after that. So if you have, for example, and community-based domestic violence advocate who has a LCSW. If they're not using the LCSW in their role as a community-based advocate, then they're going to fall under the community-based advocate privilege and confidentiality rules and guidelines that we've been talking about. So just because someone has a credential, it's really about what are they doing in the organization. So the same thing is true for supervisors. So if a supervisor happens to also have maybe a mental health license, it's really looking at what are they doing with that. Are they using that mental health license in their day-to-day job with supervising community-based advocates? So if they're not using that licensure for that particular role, then everything falls under that privilege statute. However, if they are using their mental health licensure within the scope of their position and role in the DV organization, that's where it gets a little trickier. And that's where, in terms of confidentiality, then they would have to subscribe to those higher levels of confidentiality, of exceptions to confidentiality, excuse me. So whereas we talked about community-based advocates having, primarily one major exception to confidentiality being reporting, the mandatory reporting of known or suspected child abuse, the other, if someone has a clinical or therapeutic licensure and they're using that in their role, then they're going to have all those other exceptions to confidentiality too. So that's why we want to be really clear about what are the roles. What role is that supervisor playing and fulfilling? So, and the other part of that is looking at interns. So if, for example, a supervisor is supervising an intern, it's really important to look at what are the requirements and the expectations of internship practicums. So some internship practicums, usually master's level programs, they might have the requirement that that intern needs to be supervised by someone who has a mental health license. So when you're looking at that, if someone has to have the mental health license, that's a requirement of the internship, then it is going to be best practice to follow the statutes and exceptions to confidentiality for that clinical or therapeutic license for both the supervisor and the intern. So this is one of those areas that we expect to be kind of confusing, but really looking at what are best practices in terms of protecting client information and upholding clients' confidentiality. So again, just to reiterate that we really want to look at what are the roles that someone is providing and performing within their organization, as well as, for example, with interns, looking at do they have any requirements of their internship. Again, it doesn't mean that these things are roadblocks. It doesn't mean that programs shouldn't have interns or can't have interns. It doesn't mean that at all. It means that we really want to look at what are the best practices in protecting information. So again, similar to what we talked about earlier with general clinical or therapeutic staff, really looking at, when you have different roles and different exceptions to confidentiality, then the best practice is separating those physical and electronic records. So they're maintained and stored separately. Access is limited. So again, if you have the same exception to confidentiality, then those records are stored in one place, and if a different exception to confidentiality, records are stored in another place. Same thing with kind of the gatekeeping with the access to those records. Questions?
Oh, and I was just going to add that a lot of, through the processes, we were learning more about this, that a lot of the data management systems that programs use across the state, for example, Salesforce, Cafe, have some ability to segregate some of that data. So if you're using some of those programs and you are realizing that you have some folks with different roles and you might need to separate some of that data, let us know. Also, if you're a DVP funded program, using Cafe through them, Chelsea there is a really great resource also, and we can help connect you to her if need be, and they can really help with that data segregation if you're interested in that.
That is a great reminder. Thank you. All right. So, we talked about clinical and therapeutic roles. There's a few other roles to consider when we're looking at different roles that are in some domestic violence programs. So one of those is attorneys. Some programs do have attorneys on staff. And attorneys have their own statutory mandates and ethical standards, and that include confidentiality. So similarly, the goal is that, attorneys are going to keep their own separate records, also going to utilize releases on both ends of the referral process as needed, really looking at having or creating, if you don't already have it in place, a streamlined process about what does the referral process look like if, for example, an advocate is referring to an attorney within the program. What does that process look like? Who has access to that information? So really looking at kind of just the little details around keeping things separate so that, for example, legal records aren't going to be accessible to anybody who's outside of the attorney's staff or attorney's office specifically. So that's one of the other pieces that we know comes up with some programs having attorneys on staff. Another huge thing to think about is systems-based advocacy. And, we've been talking about community-based advocates, of course. However, we know that sometimes folks are, as a part of their community-based advocacy role, is sometimes responding to different places or going different places with survivors. And so it's a really important reminder to think about the differences between systems-based advocacy and community-based advocacy. So we might, people who are advocates that are going to encounter systems-based advocates or systems-based environments that might be court, hospitals, with law enforcement, or child protective services or human services in general. It's really important just to think about and clarify what is the community-based advocate's role in that situation. What's their role of being there with the survivor, or looking at if there's a situation where community-based advocates are going on voluntary call-outs where survivors get a choice about accessing services from a community-based program, it's still necessary to maintain that confidentiality. And we know that that can be challenging sometimes. For example, even if law enforcement, for example, were asking about follow-up because they know they saw you talking to the survivor, and the survivor may have even told them that they were going to work with you or something. But the reality is that that confidentiality still has to be maintained by the community-based advocate in the situation of someone trying to follow up, whether that's law enforcement or someone through the hospital or court, really looking at, reminding ourselves that this is about protecting the survivor's information and giving them the choice about who gets to know and who gets to have that shared information. The same is true actually in task forces, like community-based task forces. Again, especially in like smaller or more rural communities, you can run into people. You might be with a survivor somewhere and run into someone and who works like maybe in the court or maybe in law enforcement or in human services. And they're seeing you with that survivor, but you still can't confirm or deny anything about that survivor. And that might seem silly or might seem ridiculous because they clearly have seen you with that person. However, again, confidentiality still holds. It's still the survivor's choice to be in charge of their own information. And I think that sometimes that, again, can feel like an extra roadblock or whatnot, because it's, that can just be a simple thing like, well, we know you're working with that person, so can you do X, Y, and Z, or can you share this information with that person? Again, remembering gently that you can say to someone that, I don't have any information for you right now, or I can't share that information. I legally can't confirm or deny that I'm working with that person. Sometimes people need that legal reminder because it's actually not something that legally community-based advocates can do. So when we think about systems-based advocacy, it's not about creating more barriers for survivors. It's really about just the clarity of what's the community-based advocate's role and reminding survivors too, again, what are the differences of exceptions to confidentiality in those situations. And lastly, another role that isn't as common for community-based domestic violence programs, but still an option for some programs. They are doing some offender treatment victim advocacy within their domestic violence programs. So, The one thing to remember, and for those of you who are, if you want more information about treatment victim advocacy within offender programs, that is absolutely something that we can always provide some answers or technical assistance about, so feel free to reach out to us about that. But when we think about offender treatment victim advocacy, that is when an offender is in typically court-ordered domestic violence treatment. Some community-based organizations have MOUs with offender treatment providers to provide that treatment victim advocacy service. The thing about treatment victim advocates, or they're also called TVAs, that's their acronym, because we need more acronyms in our world, that TVAs actually don't exist in Colorado statute. So what that means is that they exist in the Domestic Violence Offender Management Board standards, the treatment standards, but it's important to recognize that treatment victim advocates, they have different exceptions to confidentiality. So they have to report known or suspected child abuse and neglect, as well as abuse of at-risk elders. And they don't have any statutory protection regarding subpoenaing their records. So they do a lot of, their roles are closer to community-based advocacy than systems-based advocacy, but they're not actually listed in the same statute because they're technically not listed in currently any Colorado statute. So part of the reason I bring that up is that, again, if a program is doing some treatment victim advocacy, there are ways to do that, but a lot of role separation is imperative. Keeping records separate, keeping access to those records separate, as well as not having dual roles with maybe if an advocate was doing treatment victim advocacy and that person wants to also receive services from a community-based program, then not having that same advocate see that person who's coming in. So that can be challenging when your staff is really small, if that's the case, in your organization. But again, that's an area where we could do some problem solving and do some technical assistance work support if that's something you're encountering or thinking about in your organization. But it really comes back down to all of the different roles and different exceptions to confidentiality and keeping those separate. So think about all of these things. So this is a lot of moving parts. I'm just curious if any of you have specific questions about any part of the Confidentiality Toolkit. That's what I told. You got someone? Hello? Do you have a question?
I am unmuting everybody, so if you want to, you can type in questions via the chat box, or you can unmute yourself that way and ask us a question directly if you would like.
We covered a lot of ground in a short period of time, so feel free. We wanted to make sure we focused on Section 4 since that's an entirely new section and might have some areas where people might have more questions, but it can be a question about any part of the toolkit. Oh, you're all amazing experts. I'm so glad. Okay. This isn't the only opportunity to ask questions. So maybe you sit and think about it, or you're like, this came up in that webinar. What does that really mean for us? How do we do that as if our organization is small or large or whatever? One other thing that I want to say about this, about our confidentiality toolkit, and thinking about how we're focusing on best practices. And I just want to be clear, like, we're not giving legal advice. And it's important to recognize that, best practices are just that, they're best practices. They're not necessarily the same as what might be defensible in court if something were challenged. It's just an important piece to recognize. Again, we want to encourage programs to utilize client-centered and trauma-informed ways to protect survivors' information and follow their choices about what to do with their information. So really recognizing that best practices doesn't mean everything has to be super perfect. It's just about really looking at what's going to work for your program and how can we help support you in that.
Yeah, absolutely. And I think this is the kind of information that sometimes it takes a while. You have to digest it a little bit. And so, yeah, we really do just want to encourage you to reach out. Our contact info is here on the slide. You can also get it on the website. And so please reach out to us as you're digesting all of this information, as you're thinking about how it may work within your own program. Feel free to reach out to us. No question is too big or too small for us to be here. We just want to support you as you're doing this work.
Absolutely. One more thing I'll point out is that you have our contact information, and then also don't be overwhelmed by this slide. These are actually all of the templates that are available from the Confidentiality Toolkit. So, you know, we mailed a hard copy out to each program, and, you know, if you would like to request that electronically, absolutely you can do that. So just want to show you that we have all of these things, and if you would like them, you can contact us.
Yeah. Also, if you didn't get a Confidentiality Toolkit mailed to you in the last couple of weeks, let us know if it got lost in the mail or something. Or if you are needing an extra copy or something like that and you're not able to print it off, because we do have the PDF, so you're welcome to print copies, as many as you want. But if that is a burden to you, let us know. We do have a few extra copies, and so let us know. We can try and get those to you. All right, any final questions, thoughts, concerns?
Well, definitely appreciate you all listening, and again, take whatever time you need and ask whatever questions come up. We really want to support that. So thank you all for being here and for tuning into this webinar. And I hope you all have a great holiday season.
Take care. Bye.